Hello and welcome to Koç Healthcare Public Health Series. I'm Murat Aksoy, a professor of general surgery working at American Hospital and Koç University Hospital. In 2024, American Hospital and Koç University Hospital became the first healthcare providers in Europe to join MAYO CLINIC Care Network, which is a select group of independent healthcare organizations working closely with MAYO CLINIC to share knowledge and advance excellence in patient care. Today, we're kicking off our series with a topic that's really on everybody's mind, I believe, longevity. And to explore this, I'm delighted to welcome our guest from MAYO CLINIC, Dr. Brian Dougan, who is an assistant professor of medicine and a respected leader in executive and internal medicine. His work spans clinical care, physician well-being, and healthcare quality improvement, and he brings a thoughtful and evidence-based perspective to how we define long-term health. Together with Dr. Dougan and we're going to talk about the concept of longevity and how it differs between countries and healthcare systems. And of course, we're going to have a look at how MAYO CLINIC approaches longevity and how much of the current trends are grounded in evidence-based medicine and how the focus shifts from quick fixes to truly sustainable health outcomes, moving beyond popular narratives around wellness. Dr. Dougan, it's a pleasure to have you with us today. Thank you for joining us. So I would like to start with asking you the definition of longevity. Is it really prolonging the lifespan or health span or both?
Thank you, Dr. Aksoy. A pleasure to be here. And thank you for the excellent question. This is really, I think, an important place to start. When I talk with my patients and I ask them what really matters to them, it's that they're able to do the things that they want to do as long as they can do them. So the way I like to look at this is some of my 85-year-old patients will be looking for nursing home placement, and some of them will be looking for their next travel plans with their grandkids. And we all know which person we want to be. We want to be engaged with our grandkids at 85, doing the things that we want to do. So when we think about longevity, we're really thinking about lifespan, how long do we live, but probably more importantly, health span. How long do we live doing the things that we want to do and doing them independently?
Well, Dr. Dougan, when we have a look at the statistics, we see that the average life expectancy when a baby is born was around 50 years or 60 years in the 1950s, 60s. But now in Turkey, it's about 74 years, and I believe in the States a bit longer. What is your perspective on this prolonging life expectancy? How did we manage that as humans?
Oh, that's a great question. Well, over the last 200 years, we've seen almost a doubling of our lifespan. And a lot of that came from dealing with infectious diseases, now having antibiotic therapy, also vaccinations, and of course, large breakthroughs in vascular health. Now we're moving to a different set of issues that cause our end of life. If you think about the millennia, starvation was a big issue, right? So now we have an abundance of food, largely, and with that comes overnourishment and some other issues that over the history of humankind we really haven't seen previously. But to the question of how much more value can we get out of public health and other breakthroughs, it's up for debate how much more we can squeeze out. The idea that we might hit immortality at some point by addressing the mechanisms of aging. We've made tremendous strides, and we have some more benefit to gain. Yes, it's been a wonderful history of advancements, especially over the last 100 years.
A few weeks ago, I was reading a paper about an experiment which was carried out in rats. And the rats were supplemented with different molecules. And the authors have concluded that although they have prolonged health span in mice, and they had better biochemical markers. The lives of the rats actually did not prolong, were not longer. So my question is, do you believe that if we increase health span, is it possible to increase lifespan as well?
Yeah, that's a great question. We've been more effective, at least in the United States data, and this varies by country, but we've been better at extending lifespan than health span, which is the opposite of what we all want, right? So we would rather have a very healthy life compressed to the very end and have a very small period of time when we're dealing with significant chronic diseases.
Mm-hmm.
So, going to health span and lifespan, I think that they're very tied to each other. And I think, looking at mouse studies brings up a lot of observational hypotheses about what to do with human physiology. And so a lot of our hypotheses about different supplements or medications come out of animal studies, but are not quite where we need them to be to apply to our own bodies.
Sure. Not all factors which are defined in mouse studies are applicable to human beings. But is there any solid data about a factor which prolongs health span in humans?
Yes. Well, as far as supplements go, we don't have a lot of supplements that have been shown to do this. There are hypotheses. Certainly, as far as health span goes, there are things that are well established. They might not be as shiny and fancy, but regular aerobic exercise decreases 50 plus outcomes that matter to us. And if you think about decreasing depression, anxiety, heart attacks, strokes, dementia, falls, hip fractures, nursing home placements, these are all meaningful things to us, and that those outcomes, plus many more, over 50 outcomes, are decreased by simply having regular exercise, aerobic exercise. If I had a pill that did all of that, then of course everyone would want that. When we look at for a patient who's aged 40 and they quit smoking, they add about 9 years of life.
Yep.
And think about if you had a pill that added 9 years of life by the human studies, 9 years more of life. Think about the impact of that. We do have good outcomes on Mediterranean diet, especially Mediterranean diet, controlling blood pressure and good sleep. All of these things have been shown to improve health span and lifespan. We also know that social connection is incredibly important as we age. And that's one thing, at least in the United States, since the pandemic, we've definitely seen a decrease in social connection that we need to reestablish. But those are all things that definitely improve health span. And thankfully, a lot of the things that improve our lifespan also do help with health span.
I totally agree with what's been said, but there are really many factors which may have effects on our lifespan and health span, like nutrition, exercise, socializing, and everything. But I also agree with you that above all factors, exercise seems to be the most important one, maybe socialization as well. But why do you think that exercise is that much important?
For exercise, it impacts so many pathways for metabolism, our metabolic health. If you look at strength and VO2 max, those are two big determinants of how well we're going to do later in life, right? So if you were to, there's a nice study that looked at life expectancy in middle-aged men, followed for 46 years after doing a stress test one time in their mid years. And there are significant mortality differences depending on their aerobic fitness. When we look at the strength, which we can measure a number of ways, grip strength is one of the more popular ways.
Mm-hmm.
Probably your muscle strength is one of the main determinants of how long you'll live independently or health span.
Mm-hmm.
There are a lot of mechanisms for that, and I don't know if I answered your question directly, but our physiologist would probably give me a much better answer on that. As a general internist day to day, I like to look at the outcomes data, and the outcomes are very strong. So the recipe for a long life and a healthy life are well established, are well known. And so I like to apply those looking at the hard outcomes for our patient population.
Exercise is really important. And as I have already mentioned, hand strength, hand grip strength, and VO-max. VO-max is the best indicator for NAD performance, maybe.
Yeah.
And what is your recommendation for your patients as in terms of exercise? We all know that having an aerobic exercise 5 days a week is good, but people are usually missing out the resistance training and maintaining an equilibrium exercises. Do you also recommend your patients to have strength and resistance training?
Absolutely. Well, first of all, with the aerobic exercise, it used to be thought that you had to look like an Olympic marathon runner to get benefit. And it turns out that you don't have to work that hard. So for each person, they're going to have a different threshold to feel the same amount of effort. Mm-hmm. And so, getting out and simply walking for the first 10 minutes, if you just have a 10-minute break and you can get out for 5 minutes out, 5 minutes back, you have a 10-minute walk in. That's the first step, right? And then eventually working your way to 30 minutes, 5 days a week. So from the walking perspective, if you don't like walking, it could be swimming, it could be biking, it could be anything that gets your heart rate up, but it doesn't have to necessarily even be in workout clothing. So I wear a suit to work, and I like to take the stairs. So I'm on the 5th floor of my building. So I will go up 5 flights of stairs in the morning. That's okay for me. I'm 56 years old, and that works out just fine. But for some people, that would be too much. But just simply moving seems to be the first step. So from the aerobic capacity standpoint, we'd like to try to improve our aerobic exercise capacity, as we mentioned before, the VO2 max, which measures how aerobically fit you are. And that is probably, when you and I do treadmill studies to look at a person's heart function, the top predictor of how long they will live from the cardiac perspective, cardiac mortality, is actually how long they exercise on the treadmill. It's even more predictive than chest pain on the treadmill if a person drops out early compared to chest pain or ECG changes. So that's the base. Now, going back to your other, the main question here is, what about strength training? Well, we know that's very important. After age 50, without strength training, we lose about 1 to 8% of our muscle mass per year. So resistance training becomes very important for all of us, and we can start to build muscle up until age around 50 and then sustain. And the best approach appears to be exercising with resistance training 2 to 3 times per week, hitting all of your major muscle groups in that time. So in about a half hour, you can do 1 set to failure and do quite well as far as strength training goes. So that's what I encourage my patients to do, is to focus on getting 2 to 3 episodes per week, hitting all the major muscle groups, starting slow and working with a trainer who can help you with that, because mechanisms, your technique really matters a lot. So as you age, injuries start to come up, and we'd like to keep you healthy and not have to back off of the exercise. So we may talk more about protein later, but protein becomes part of that equation. But those are really important. Then there's another part of physical activity that I encourage, and that is stability exercises.
Mhm.
So how long can you stand on one leg, for example? There are ways to improve your coordination to stay upright and avoid falls, which as you know, if you think about all the people who have aged and need more and more assistance,
Mhm.
falling is a big issue. And if you can maintain your gait stability, maintain your balance training can be a very important thing. And then one final thing, as we age, we get less flexible. So functional flexibility is a real important part, or functional motion is an important part of allowing you to participate in as many activities as possible. So working on flexibility, you can do things like yoga, Pilates, and then for the training to stay upright, you could do other things such as Tai Chi if you enjoy those kinds of activities. There are other things, activities like playing pickleball or tennis or things that keep you on your toes as late as you can into life. But all of those things, all of those components of physical fitness that's like money in the bank for later in life.
Mhm.
That's something that you'll really thank yourself later if you do that right.
Exactly. It's the best investment a one man cake make in his life, actually, is doing exercises. But when we're talking about health, we are recommending our patients also to exercise regularly and have all the exercises. But they would likely mostly talk about nutrition, actually. And I always tell them that more than nutrition, hunger is more important to keep our health. Because we know that from the early 1900s, from many studies, calorie deficit is one of the best ways to maintain our health. What are your thoughts on this one?
That's absolutely true. That's been shown in mouse studies. Now, in mouse studies, it's easy to control their diet,
Mhm.
and easier than it is for me to control my diet. But you're absolutely right that a calorie restriction has been shown to be beneficial. There was one study where they had patients they aimed to reduce their calories by 25%, a deficit of 25%, which, for me, hunger is miserable. And I can't imagine being a participant in the study. Now, over 2 years, they followed these patients and they were able to achieve about a 12% calorie restriction,
Yes.
right? So 25 is a lofty goal. 12% is very admirable to me. And so they showed significant improvements in a lot of the secondary outcomes. Uh,
Mhm.
they lost weight, they had decreased LDL, increased HDL, lowered blood pressure. There were a lot of impacts there. I would say that that's a very hard thing to do, and that was a very controlled study. For me personally, how do I approach this? Well, uh, you know, in modern society, we have lots of opportunities to eat, many more than we used to. Even in the 1970s in the United States, our children had many fewer opportunities to eat, and we have many more foods that are uh, highly processed and rapidly absorbed and not healthy for us. So when we look at, how do you apply the calorie restriction data to your everyday life? I think there's a couple things. One, watching the portion sizes, right? So it turns out that if you start with a smaller portion, uh, you will stop earlier when you're satisfied.
Mhm.
Eating slowly also helps so that you don't get ahead of your satiety. And so eating slowly and deliberately. Also being mindful about what you're eating. So if you are watching a movie and you have a large bag of popcorn, it's better to put it into a bowl and make it easy. And then the other thing is being willing to eat when you get hungry, rather than eat because you see the food on the countertop.
Mhm.
Uh, so there are a few tricks that you can use in there. One study showed that what you have in front of you is what you will eat. So if you open your cupboard and the unhealthy, high calorie density foods are sitting there in the front, That's most often what you'll grab. So one thing that my wife and I do is we put a big bowl of fruit on the countertop. And so when we or the kids say, "Gee, we need a snack," well, we'll have an apple, which has all sorts of phytonutrients in there. It's low calorie density, and it's and it's delicious. So moving towards the foods that we want to add, the 5 to 10 fruits and vegetables a day, the whole grains instead of white flour foods, olives, olive oil, tree nuts, some poultry, fatty fish like salmon a couple times a week, much less of the red meats. When we look at that as a Mediterranean diet, having those foods readily available so that it's the first thing that comes to your mind is a good way to use lower calorie density foods and hopefully get closer to that calorie restriction that we're talking about. I like to think about, along those lines, if you think we were talking earlier that, over the millennia, starvation was the main threat to humanity. And, the genes that were selected out over the generations were the ones that kept us from starving.
Does it?
Right. And so when the food was available and plentiful, it was time to build, to store up extra calories. Well, now when we have all these calories available to us, well, people tend to stock up. But if they don't have a limited time they stock up, then it becomes a problem.
Does it?
Yeah.
Talking about nutrition, and as you have mentioned, getting away from snacks and maybe towards fruits is a good idea. But on the other hand, talking about carbohydrates and protein, as we age, recently we're talking about what is the optimum intake of protein should be. Because as we age, we know that there is a lack of nutrient sensation, and we're losing that capability in our body, so we cannot use proteins as much as we'd love to. We would have the advantage of having a protein maybe 0.8 milligrams per kilograms in our 20s, 30s, but as we age, that amount doesn't seem to counter-effect, it doesn't seem to affect our lives. So should we increase our protein intake as we get older?
Yes, that's a great question. In recent guidelines, they moved up the amount of protein that especially those over 65 should be taking in. Now, one caveat to the protein story is that if you have liver disease or you have kidney disease, that will change your doctor's recommendation. So if you're very healthy from that perspective and you can take extra protein or take adequate protein, I should say, the goal would be 1.2 grams per kilogram per day. So for most people, that's somewhere around 25 to 30 grams each meal, 3 times a day. And, if you look at how you spread it out through the day matters, right? And if most people get plenty at supper time, they get some at lunch, and they may miss breakfast, and they may not get much of that. Now,
and sometimes it's not really very easy to get that much of protein during one meal.
That's absolutely right. And I had to do a little research myself on what I liked. There's a lot of proteins that I'd rather not encourage, right? So red meat. Red meat is full of protein.
Yes.
However, it's also saturated fat that we know is a big or headwind to our health. So as far as healthy proteins go, for example, I like low-fat dairy as one source. And for breakfast, I have a hard time getting enough protein in otherwise because I don't eat, I eat a little poultry, but I don't eat any red meat. And I don't generally have fish for breakfast, although that's perfectly fine. So what I like is I have a bowl of berries that are frozen that I thaw overnight. I put some nuts and some high quality granola on that. And then I put a cup of Greek yogurt. So 1 cup of Greek yogurt is 30 grams of protein. And that's how I get to that morning dose. I have to confess that there are times when it's hard to fully get to that 30 grams. It's just very challenging unless you really think it through. We have, again, poultry, we have tofu, good source of protein, low fat, fatty fish is a good one. And I like salmon. I like some of the light tuna to do that. I like chicken. And so, some people find themselves adding a little protein supplement, some whey protein. I'd prefer not to do that, but on occasion, if that's the only way to get that in, that can be one way to get there with one scoop. Good.
What about plant-based diet? When you look at the longevity studies, you see that people who are on plant-based diet seems to live a longer and a healthier life. Although the difference is not dramatic, they seem to have a longer life.
It may feel like
what about the bioavailability of plant-based proteins and animal proteins-based proteins?
Yeah, it's a great question. The people who promote plant-based diets would say, you know what, it's close enough. Go ahead and use plant-based. That's fine. There are some data that some of the leucine-containing amino acids are lacking in the plant-based diet, though I would say a plant-based diet is very healthy. And that I would say is number 2 to the Mediterranean diet. And my wife happens to be plant-based, so she goes that route. So I have to cook my own fish. But as it stands, I think that's a very good diet. When you look at the thousands of phytonutrients that are in a plant-based diet, quite valuable. We also, if you think about what's the top cause of death in Turkey, well, it's heart attack.
Heart attacks.
Yeah, if you look at vascular health, that's the thing. Heart attack and stroke, top 1. Cancer is number 2. And then lung disease, COPD, would be number 3. So, it turns out that all those phytonutrients are there to help us with vascular health, to help us with cancer reduction. And, one of the biggest drivers of vascular health in Turkey and the United States is high blood pressure. It turns out that, with the plant-based diet, especially low sodium plant-based, is very valuable. A low sodium Mediterranean called the DASH diet has been well studied to reduce blood pressure naturally. So, if you're looking for ways to have fewer medications or to avoid medication, we always start with the DASH diet for blood pressure reduction, looking at those top issues that are part of our life experience.
I guess knowing yourself and your family history is also important. For example, through my life, I have experienced a vegetarian diet for 2 years and then switched to intermittent fasting, and I sometimes do calorie deficits. So I think one has to review himself or herself and see what is best for him or her, actually. Do you also believe that this is true?
I think how you feel is important. I think that when you look at the options that we just talked about, the DASH diet, Mediterranean diet, and the plant-based diet, I think the important take-home point is to say you can eat very well and eat very good, meaning you can have a very enjoyable diet within any of those 3 options. And so I think that, our social activity, eating with each other, is very important. And
eating is an important feature of culture, actually.
Absolutely. I for a long time I didn't eat any meat at all, and probably about 8 years I was plant-based entirely. I was having a hard time, by the way, finding enough protein in my plant-based diet. So that's one of the reasons why I started to add a little bit of chicken. And actually, I should say I was close to plant-based, more pescatarian. I was eating fish plus plant-based diet. when I would eat with other people, sometimes they would serve something that wasn't on my menu, you know, and no one can be perfect. So on occasion, I was traveling to Saudi Arabia one time and a couple of years ago, and they had this wonderful beef dish. And it's kind of outside of my menu. And they knew that I was plant-based. And so they were giving me a hard time. And they said, you have to try this. And I have to say it was lovely. So no one's perfect on that. But I think, going back to what we do 90% of the time does matter quite a bit. Moving away from processed foods, moving more towards whole foods that have not, when we process foods, we take some of the goodness out of them. And then also biologically, we insert new signals that are active with our metabolism and our satiety. How long do we have to eat before we feel full? Well, with some of those high calorie density foods, you can put in a tremendous number of calories before you realize that it was enough. So we have a lot that we can do with diet, and it is high yield. If you get this right, just like exercise, this is important. One other thing I'll just mention about the protein, when we're talking about maximum protein synthesis, protein alone won't give you muscle. You have to do the resistance training plus the protein, right? And that's what we're really going for. And so if you work with your doctor or a nutritionist to have a list of options that are healthy proteins, and you don't do the aerobic or the strength training, I should say, if you don't do that resistance training, you won't really get the benefit that we're looking for from the muscle protein synthesis perspective, right? And so you want to have your exercise, let's say on Monday with the strength training, and your next strength training should be at least 48 hours later. During that time, you're building muscle during that break before the next workout, and you're feeding your muscle with the protein that's adequate to do that. So that's kind of the recipe. You need both of those together. And I didn't want to forget to mention, one can't go alone. It has to be both. Yeah.
Sure. And there is also another factor which affects our lives really very deeply, and that is sleep. And it's maybe the least debated issue in this longevity period. Which diseases are related to lack of sleep? Because we know that there are many people who are having maybe 4 or 5 hours of sleep during a night, and they're promoting it, and they're, proud of it, having less sleep.
Yeah.
And I think it's one of the most important dangers that we should avoid, actually. So which diseases are related to lack of sleep?
Yeah, it's actually quite a long list, and a lot of things that are meaningful. For me, I think about Alzheimer's. Well, I think about dementia, right?
Mm-hmm.
I think about high blood pressure, cardiovascular disease, physical injuries go up with poor sleep. Hunger goes up because our hypothalamus of our brain has a hard time knowing the difference between hunger and sleepiness. Obesity goes up, depression, anxiety. Our immune system is affected by it. So we have, actually cancer rates go up, mortality goes up. So we know that, we've always said 7 to 9 hours of sleep. In order for me to get that 7 hours, I need to be in bed about 8 hours, right? So if you look at some of the wakefulness through the night, no one sleeps perfectly. Sleep is very important. It clears out the toxins in our brain. It gives us the ATP molecules in our brain to think the next day. So if you think about what's your mood the night after 5 hours, well, keep doing that night after night. How impactful is that in your joy, your depression symptoms, anxiety, your hunger? I'm sure when you were doing all night call in residency,
Yes.
I realized that morning after my night call, I couldn't get enough fatty foods.
It's much more easier to catch a common cold after, a sleepless night.
Yeah, it's if you ever want to read a very interesting book on this that really, if you didn't think sleep was important, read the book Why We Sleep by Matthew Walker. He's from Harvard, a sleep expert. He's also on, you'll see YouTube videos on him, but very interesting data. I'm convinced I actually have an alarm to tell me it's time to go to bed.
Yes.
Right. So I have an alarm to wake me up, but I also have an alarm that reminds me at 8:30 it's time to start moving towards bed. And I aim to be in bed at 9 p.m. For me, that works.
Do you recommend your patients who have sleep problems melatonin supplementation? Because there was an abstract which was presented in one of the congresses and it was related to heart failure, but I don't think it came out as a paper yet. But it was all over the news.
Yeah, I saw there was an observational study
Yes.
on failure. So that does raise the hypothesis that maybe a randomized study would show benefit, and that needs to be done. But I would say, I think that the benefit of melatonin is probably best in travelers who are trying to reestablish a new sleep pattern. It gives you a little bit of darkness. It's kind of like giving yourself darkness in a dark room and telling your brain it's time to go to sleep. It doesn't keep you asleep. But, sleep disorders are also really important to address, obstructive sleep apnea. There was one study that showed that if they asked you this question, has your doctor ever said that you have a sleep disorder? And if you answer yes to that, the odds ratio of mortality was almost as bad as a stroke, and it was about the same as having a heart attack. So we underestimate the importance of treating sleep disorders. And the other plug I'll just say is a lot of people think that maybe they should be on a sleeping pill, one of the sedative drugs to keep them asleep. That hasn't been shown to be very helpful. In fact, it may be very harmful in some people. So cognitive behavioral therapy for insomnia is the first line therapy and has been shown to be very beneficial for people who are having trouble with good sleep quality because of insomnia. So there are good treatments.
Do you have any recommendations for people who work in night shifts? Because the circadian rhythm is really affected in some certain professions like surgeons, nurses, policemen, firefighters, and so on.
Yeah, shift work is very challenging, and it is associated with increased risk because of the sleep disruption. So I wish that I had a good solution for that. I know that I would not be a good shift worker. I've not done well with nights. I don't perform well the next day. Probably the best thing you can do is make sure that you're getting adequate sleep at the time that is your sleep time. So dark, quiet room, no animals in the bedroom, avoiding alcohol that disrupts sleep, avoiding caffeine after what would be your noon, whatever your noon is. So it's important that you not give yourself stimulants and then give yourself a very good quality sleep environment. So that dark, quiet, cool room is a really important part when you do have the opportunity to sleep. And the good news is that to some extent, we do have more REM pressure. Our REM sleep comes back with a vengeance once we do get to the bed. And so there is some makeup there. But if you have a rotating shift, that's very challenging. And that's something that I've opted out of in my life, mainly because it's so hard, for me. Some people seem to get along just fine with it, and they can look refreshed the next day, and I have no idea how they do it. But yeah, sleep is a very important component of how healthy we're going to be and actually how long we live. And if you have a young person who's athletic, that's probably the least understood, the least appreciated part of an athletic program is adequate sleep for recovery, muscle protein synthesis. That's when we build our muscle. That's probably the most anabolic thing you can do for your muscles is to sleep. And,
Exactly.
So that's the best.
As we're coming to the end, my final question is going to be this one. What would be your recommendations for a person who has genetically ill history in terms of family history, for example? There are many, if one has got many diseases in the family, how can he have a better life?
Yeah, that's a great question. So probably the highest yield thing would be to recognize early heart disease or stroke, right? So early vascular disease, as we alluded to, that's the top cause of death. It also is one of the top causes of disability and poor health span.
Mm-hmm.
So, if you think about an early history of family members having heart attacks, for example, before age 60, uh, when you start to look at, well, why is that, right? Is it just the cholesterol? Some of the new guidelines would suggest that we should be checking a lipoprotein A, so we could look at that. We could risk stratify further around age 40 with a CT coronary calcification study. We can look at ApoB. We can look at C-reactive protein. So there are a number of, if the doctor knows that there is a family history of early heart disease, for example, or stroke, they can start looking for underlying genetic components of that may be treatable, and then also might cause a stronger stance towards control of cholesterol, for example. We also know that we have increased risk for cancer in some families. That's another genetic component that we may notice. And so sometimes there may be, for example, the most commonly known is BRCA1 and 2, where you might see an increased risk of breast cancer and ovarian cancer, male breast cancer. So that changes our approach to cancer screening and also
Yes.
prophylaxis for the cancer. There are other diseases that run in families, and I think that collecting your family history is a very important component of all this. More and more people are going to just testing all of their cancer genes or their whole genome, and of course that's something that does have some yield, and the price is coming down. Dr. Aksoy, when you and I were watching the Human Genome Project unfold,
Yes.
that was like $100 million to do the very first genome. Now, for about $2,000, you can do your whole genome, right?
Yes.
And so there are some insights that may be a pitfall for some people, right? Because they actually might find something they wish they hadn't known about. They didn't want to know that. So you always want to talk with a genetic counselor before you jump into that kind of exercise, because it has impact for you and your children, your siblings. And so it's not just you alone in that whole thing, but it all starts really, I think, with collecting a family history with your doctor and talking about the patterns of disease that may have gone down your mother's side or your father's side, in your siblings, in your children. When those kinds of patterns start to pop up, that's a red flag that needs to be talked about.
Thank you very much. It was a real pleasure to have you on the show.
Very good. Well, thank you for having me. It's been very nice to meet the Koç family and just getting to know you and the rest of the team. And
likewise.
I wish you and your patients well.
Thanks so much. And thank you all for who have already joined our show, and see you next time, next chapter. Bye-bye.